the president and CEO of March of Dimes. Stacey, so glad to have you here on the show. Thank you for being with us.
Thanks, Shannon. Great to be with you.
This is so troubling. Black mothers are 3 to 4 times more likely to die than their white counterparts. What is going on here? Can you explain this?
Yeah, it really is troubling. And unfortunately, it's also not a new issue. In fact, the rates of maternal death in this country have actually doubled, more than doubled over the past 25 years. And we have some of the worst rates as compared to any other highly industrialized country in the world. In fact, today, the U.S. is considered the most dangerous developed nation in the world in which to give birth. And that's especially true for Black mothers, other women of color, indigenous women, and others. And this is just something that really is a crisis that has been in place for a long number of years, many years. But fortunately, we are now, as a country and as policymakers and everyday people, are paying more attention to these issues, trying to understand them better, and finally on our path to doing something about them. And we still have a ways to go, but we are making some movement, and there are some encouraging signs that we're attempting to move in the right direction to address these issues.
Although we're moving in the right direction, it seems when they're reporting potential warning signs or complications while pregnant. And in fact, a quarter, for Black women, they actually report this abuse, this disrespect to their medical professionals. But why is this not being taken seriously? Why is this health community not listening to these women when they are reporting these issues?
Direction. We're beginning to see some promising signs on the policy front, both at the federal level and the state level, that policymakers are finally taking this issue seriously. But the fact of the matter is today that we still have major issues with respect to maternal and infant health outcomes, really, where, as you mentioned, Black women are 3 to 4 times more likely to die as a result of pregnancy and childbirth. And even, Shannon, a highly educated Black woman with all the resources in the world, access to information, education, and coverage, is still 5 times more likely to die as compared to her white counterpart. So when we strip away all the issues around income and education and access to resources, what's really left is the color of her skin and how she is treated by the healthcare system. But also, as Black women, what our lived experience is in this country, having to deal with the effects of racism and the kind of effect that has on our health over time. There's a notion, there's an idea that's been studied and researched called maternal weathering. And what it says is that for Black women, our birth outcomes tend to decline the older we get as compared to white women who, as they age, their birth outcomes tend to improve. The issue for us is as we get older and as we have to bear the effects of racism and discrimination in this country, it has a weathering effect on our bodies. It has a weathering effect and a worsening effect on our health, and that is also complicating our birth outcomes as well. So one of the things that's really important about this is we have to recognize that, about 80% of our health is really determined by how we live. So as Black and brown women, if we're living in places with not no access to safe and decent, affordable housing, a lack of access to good nutrition, if we're living in ways in which we feel the effects of discrimination, that then will have an effect on our bodies and our health and our babies as well. And that really is at the core of these inequities that we see. That's the work we're doing at the March of Dimes. It's with so many other organizations to try to address these issues systemically so that we can actually turn this tide around. We certainly need policy changes in place, practices in hospitals and with healthcare providers too, dealing with implicit bias so that nobody that goes to a healthcare provider, no Black woman and no woman of color, when she shows up at the clinic or the healthcare provider, feels that she's being discriminated against or not treated fairly or not treated respectfully, is another important issue, eliminating that implicit bias in our system. So it's really a comprehensive approach that we have to take. But, again, we are starting to see some movement in the right direction to addressing this at a systemic level.
And I'm glad there are organizations out there like March of Dimes to help educate people. So can we give some actionable tips or advice to mothers to be out there on things they should do, maybe questions they should ask their health providers so they don't end up in this situation to begin with? For example, when we were pregnant with our kids, we interviewed the doctors. We took tour of the hospitals to try to get people's perspective and vibe and feel for these people. But what should people be asking when they have these conversations?
So I would say we have to address it at two levels. One is at the individual level. And yes, you're exactly right. As a woman, as a spouse, as a partner, it is really important to advocate for our own health. And it's really important for a woman to have another partner, friend, spouse, family member to help advocate with her. That can be very important, especially if a woman is not able to advocate fully for herself. Maybe she might be in a situation where she's in pain or having symptoms. She needs someone else by her side, knowing that every single individual woman has the right to be heard, listened to ask questions until she's exhausted, but that she gets the answers that she needs is a right that she has. And she should demand the right to be listened to be heard, and to be responded to in the way that she feels is appropriate for where she is in her pregnancy journey, before pregnancy, during pregnancy, and even after pregnancy. That is a level of self-advocacy that we would encourage for every single woman. But there's another level of advocacy that we need as well, which is how do we come together and advocate for our own communities, for
Mm-hmm.
every single woman to get that kind of treatment. And that's what we're also doing at the March of Dimes, is really encouraging people to join us, to be an advocate for maternal and infant health. California just passed a really an amazing set of legislative actions to really address maternal health at a systemic way,
And I'm
expanding
glad you.
the care for
Mhm.
doulas and others. And we're doing that at the federal level as well.
No, I'm glad you brought that up because California Governor Gavin Newsom seems to be one of the advocates who want to help you all and mothers out there. He signed the California Momnibus Act last Monday. So could you explain a little bit more what this bill does and how it can help black moms?
Sure, absolutely. So the momnibus word is really something that hopefully a lot of people will hear more about. At the federal level, there's been a Momnibus Act, which is really not just one bill, but actually about a dozen bills that really comprehensively addresses maternal and infant health. California, as a state, has taken the leadership among really all states in the country in putting together its own Momnibus Act. And what it does is it addresses the issue of maternal health in multiple ways, expanding doula care for women so that any woman, irrespective of her income or race or ethnicity, could access doula care, which is really an important part of uh, getting the right level of support and coaching that women often find is very valuable to them during pregnancy. Extending Medicaid in California 12 months after the baby is born, postpartum, which is when usually about a third of all maternal deaths happen. Looking at expanding midwifery care and a whole range of other things that are really important, again, to address the systemic nature of this problem. That state, California, really has taken a very bold set of moves to address this. We would encourage every state to take what California has done as a model. But what we also need to do is pass the federal Momnibus Act, which has been
Mm.
introduced by the Black Maternal Health Caucus, and the March of Dimes and so many other organizations are advocating for it as well. We would ask people to sign up and become an advocate. It addresses many of the same issues and goes even further,
Well, do
looking
you
at
think that's
moms that are
possible?
in the
Do you think that's possible that that's going to
uh,
move any further than this, than just a
well,
proposal?
we all have to wonder how much can be done in Washington, right? But the encouraging signs are this: it is a part of the Build Back Better Act that emerged out of the House Energy and Commerce's committee's work. It is a part of budget reconciliation. We certainly hope that it will make it through budget reconciliation. About $1 billion has been proposed to support the implementation of Momnibus. It has a lot of support, including Senator Schumer as a co-sponsor, and Senator Cory Booker has been an amazing advocate, with in addition to House members like Congresswoman Alma Adams, as well as Congresswoman Lauren Underwood. So there's a lot of momentum, a lot of support. But yes, it will pass and it will move through Congress if our voices are heard and if we demand the kind of care that every single woman in this country should receive, especially Black and brown women in this country. So if you're interested in being a part of it, we certainly would love for everyone to join us at the March of Dimes to advocate for Momnibus and get the help and the support we need that every Black mother, every Black pregnant person should receive, so that our moms are healthy and our babies are healthy as well.
I love your confidence. You make me want to stand up and just start clapping. I'm like, yeah, tell them we got to pass it. But you know what? Unfortunately, thanks to the pandemic, we've actually seen how structural racism impacts communities of color because of everything that we've been seeing lately. So how is that same discrimination being carried out in obstetrician offices and delivery rooms and hospitals?
Well, we see it in so many areas of our lives, right?
Mm,
Again, going back to this idea that really the effects of racism show up in every part of our lives. When we put in the application for an apartment, or when we apply for jobs, or when we demand a certain kind of treatment and demand not to be profiled in a store that we're in. I mean, these are all the both subtle and overt signs of racism. And of course, when in the healthcare system is similar to every other social system that we have, where Black women and other women of color experience far too often the effects of racism. When a woman is covered by Medicaid and shows her Medicaid card, and even the receptionist may not respond to her in a respectful manner, that just simply isn't fair for women to have to deal with that level of treatment, that lack of respect. And part of what we have to do is undo that idea of those sort of implicit biases that really all of us have on some level in some ways around anything you can imagine. But the problem is that when any healthcare provider has an implicit bias against a woman of color, and that then stands in the way of adequate, high quality care being provided to that woman, that's when it's a problem. And that's what we have to do and part of what we're working on the March Dimes is helping people to identify their own implicit biases, especially if it's directed towards a woman of color, understand what it will take to undo that bias so that better care and high quality care can be received by the woman who needs it at the time that she needs it. We know that all these cases of maternal death, about 60% of them are avoidable if healthcare providers simply diagnose the problem, treat the problem, and respond in a timely and respectful manner. So as long as we can have a healthcare system that responds to every single woman, irrespective of her race, her zip code, where she lives, her ethnicity, then we can start the process of getting the level of treatment and the level of care to all women. And again, we think that
mm.
every single woman in this country, especially women that look like me, um, deserve that kind of care and they deserve that treatment. And we should demand no less from our healthcare system.
That's right, Stacey. And I know the March of Dimes is doing a lot of work to make sure that they can put a stop to a woman dying every 12 hours because of pregnancy problems and 1 in 10 children born having these premature issues. How can we participate? Really quick, we only have a few seconds left. How can people get involved in March of
Yes.
Dimes?
Please go to our website, marchofdimes.org. We're not the only organization working on this. There are others for sure, but we would love to have everyone get on board, become an advocate. Go to marchofdimes.org. Look under Momnibus, look under advocacy, sign up. You can get alerts and know when to contact your congressperson to make sure that your voice is heard when Congress considers Momnibus, so we can get the $1 billion investment, which I think is a down payment on this issue. We will need more and more attention and funding paid to this issue, but it gets us going in the right direction and gets us started on reversing these awful outcomes and the trends that we've been seeing around Black maternal health.
All right, Stacey Stewart, thank you so much for joining us this evening on Amplified.